Okay, so it's 9:05, so we'll go ahead and start the Public Health Preview Day. Good morning, everyone. My name is Deepti Jan Miller, and I work at the University of Louisville School of Public Health and Information Sciences. Thank you again for taking out time today on a Saturday morning to join us to learn more about public health. We have our esteemed faculty members, our leadership team here, as well as our staff who will be helping all of our students today to learn more about the school. We will begin with the agenda, where we will show you what the day looks like today and who all you will be meeting throughout the day. So to start off with, it's me, Ditya Miller, as mentioned. I'm giving the opening remarks, and I will be here till the end of the preview day to help you all navigate the preview day as well. Shortly after me, we will start with a welcome from our interim dean, and then we have 5-minute introductions from our four departments, academic departments: bioinformatics, biostats, EPI, health management and system sciences, as well as health promotion. After that, we will have time for one-on-one connections. So at 9:45 a.m., we will start our breakout sessions, wherein you will find 7 breakout rooms that you can choose to get into. You can meet faculties and staff from that particular department. If you are not sure, or if you're just looking for graduate admissions details, you can also join the student services and graduate admissions breakout room. If you are a high school student, for you, you have the undergraduate public health programs breakout room. For the rest, we have the academic departments as per the program that you're interested in. Please be mindful that you can definitely, step between step out and in of a breakout session. So if you're interested in, for example, EPI as well as bioinformatics, you can definitely spend time in both these sessions as per your need. We will have a student panel discussion. So we have amazing panel of our student ambassadors ready to meet you all at 10:30. And finally, after that, our team of student services will be online at 11:15 to answer any last minute questions that you may have. With that, now I will not take much time and pass it on to our interim dean, Dr. Kathy Baumgartner. Thank you.
Thank you, Deepti. Good morning to everyone, and welcome to the 2026 Winter Preview Day here at the School of Public Health and Information Sciences, University of Louisville. As Deepti mentioned, I've served as interim dean since March, and I've been part of this school since 2005 in roles that have supported both faculty as well as academic affairs. It's been an honor to help shape the school over these many years alongside many of the dedicated faculty that you'll meet today, along with the staff. And so just as a note, the last 10 years have been, yes, seen many trying times for all of us who are committed to public health, but nevertheless, we have all seen advancements as well as those challenges, and we do remain committed. The faculty in our 4 departments focus on biostatistics, epidemiology, health promotion, health policy, along with our phenomenal, and I really do mean that, phenomenal student services group, our dedicated faculty, and our caring departmental staff are all committed to student success. We invite you to visit with our faculty and staff at the breakout sessions later this morning to better understand all of the many programs that are offered here at our school. We hope that you'll be excited by what you hear later this morning. And whether you join us online or whether you come to the campus here at the University of Louisville, we're here to support all of you, both incoming as well as current students, in the pursuit of your goal, along with us, to improve the health of communities. I hope all of you have a wonderful day, and that I'll now turn this over to Dr. Kulkasera, Department Chair of Biostatistics and Bioinformatics.
Good morning, everyone. Welcome to the School of Public Health and Information Science. My name is Dr. Qi Zheng. I'm an associate professor within the Department of Bioinformatics and Biostatistics. I'm very glad to have the opportunity to introduce our department and our graduate programs to you today. I hope this gives you a clear sense of who we are, what we teach, and how our programs can support your career goals. I encourage you to reach out with any specific questions about research or curriculum. Um, the mission of our department is threefold. First, we advance statistical and data science methodologies through cutting-edge research. Second, we provide statistical rigorous collaborations to investigators across medicine, public health, and in many other disciplines. Third, we disseminate knowledge through education, training next generation of biostatisticians and data scientists. Everything we do, from research to teaching, is grounded in real-world impact. We offer a full spectrum of graduate programs to meet students at different stages of their academic and professional journeys. These include an online master program in biostatistics, an MPH with a concentration in biostatistics, an online graduate certificate, and a PhD in biostatistics. We also offer a dual degree program combining a PhD in applied and industrial mathematics with an MS in biostatistics. Many of these programs are STEM-based and available online, providing flexibility for working professionals. Next slide, please. Why choose biostatistics? Biostatistics is currently one of the most sought-after areas of expertise in the global job market. Employers across healthcare, pharmaceuticals, government, and the industry increasingly rely on data-driven decision-making. While a bachelor degree provides a foundation, a graduate degree is often the key to unlocking leadership roles in industry. Masters and PhD holders see significantly higher compensation and a much higher ceiling for career advancement. For those unsure about time commitment or coming from a non-quantitative background, our graduate certificate is an excellent stepping stone to gain the skills needed to realign your career. For those looking forward to R&D and academia, our PhD program is the gold standard. Next slide, please. Our MS program is designed to both rigorous and practical, giving students a strong and flexible foundation. You will learn statistical methods that can be applied across industries, not just public health. We emphasize hands-on training in statistical computing and data management using industry standard tools such as SAS, R, and Python. This is one of the few truly comprehensive biostatistical programs in the nation, and it's open to students from diverse academic background as long as you have some quantitative exposure. The program can be completed in as few as 3 semesters, with part-time and fully online options available. For students who need additional preparation, the certificate program can serve as a stepping stone to the MS. Next slide, please. We are especially proud that our MS graduates have a 100% placement record, including those who continue on to PhD studies. Our MS graduates go on to a wide range of careers. Many of them go directly to high-level roles at pharmaceutical corporations, insurance companies, hospitals, and government agencies like FDA or NIH. Others find success at major tech and logistic hubs like Google and UPS, with a median annual salary exceeding 86,000. Our graduates are well positioned for financial and professional successes. Next slide, please. For those aiming to the highest level of research and teaching, our PhD program offers a clear path into academia and specialized industry R&D. Our PhD graduates work as faculty members and researchers in academia, as well as in pharmaceutical companies, government agencies, clinical trials organizations, and the industry. They lead clinical trials and influence policies at the highest level of the government. The financial reward reflects this expertise. In 2024, the median starting faculty salaries for PhD graduates in our field was approximately $130,000. The PhD program is ideal for students who are interested in leading research, developing new methods, and shaping policy and innovation through data sciences. Next slide, please. A key strength of our department is our strong network of collaborations and partnerships, which directly enrich both our research and student training. At the state level, we participate in the state university partnership program supporting applied policy relevant research. Nationally, we collaborate with institutions such as Luers Children's Hospital in Chicago and work closely with major research centers here at UofL, including the James Brown Cancer Center and the Louisville Clinical and Translational Research Center. This collaboration create a real-world research opportunities for students from clinical trials to population health studies. In addition, our statistical consulting facilities allow students to gain hands-on experience working with investigators across disciplines, applying biostatistical methods to real problems. Together, this partnership ensures that our students are not only technically strong, but also prepared to work in collaborative environment. So in summary, our department offers flexible, rigorous, and career-focused training in biostatistics and bioinformatics. Whatever you go, we have the framework to help you reach it. And thank you for your time today, and I'm happy to answer any questions you may have. Thank you.
Thank you, Dr. Chang. Next, we have Department of Epidemiology and Population Health, Dr. Richard N. Baumgartner.
Good morning and welcome to Preview Day. I'm the chair and professor, long-serving of the Department of Epidemiology and Population Health. Epidemiology, which I presume many of you may know, is the basic science of public health and arguably also medicine, in that the goal of epidemiologists is to understand the etiology or causality of disease, disability, and even other health conditions through a population-based approach. Historically, epidemiologists collaborating closely with biostatisticians, medical scientists, both basic and clinical, have really unraveled the causality of many different diseases, ranging from infectious to non-infectious. Our epidemiology department offers several programs. We have an undergraduate minor, excuse me, in epidemiology, 18 credit hours. We have a 45 credit hour concentration in our MPH program. We have a new entirely 100% online MS in epidemiology, 30 credit hours. This is a significant achievement of our department in the last couple of years, and that there's only 3 such MS programs in the entire United States. And we have a PhD specialization in epidemiology, 56 credit hours. It's quite intensive. Next slide, please. So here's just a rundown of our faculty. There's me. My expertise is broad because I've been around for quite a while. I've studied cancer, nutritional basis of health and disease, something called body composition, which overlaps into exercise sciences and obesity research. I teach the history and theory of epidemiology within the department. Uh, Dr. Kathy Baumgartner, our interim dean, is one of our faculty also. Chengwei Zhang is a basic scientist, MD, PhD, who does a lot of environmental research. Dr. Kira Taylor is interested in reproductive and women's health and genetics. Dr. Ann Wallace is our expert in maternal child and global international health. Next slide. Dr. Nick Piper, who is associate professor but is on track to be promoted, is our expert in social and psychological issues. Mental health, eating disorders is something that he's recently branched out into. Dr. Stephanie Boone, associate professor, covers cancer and cardiometabolic disease, is the principal investigator of the Kentucky site of a new multi-site cohort study, as it's called, around cardiometabolic disease in rural areas of the country. One of the basic questions that epidemiologists try to answer is, why is the population distribution of various diseases like heart disease, for example, non-randomly distributed when you look at it in terms of person, time, and place? And rural America in particular has a lot of difficulties, increased rates of various and sundry diseases, heart disease being one. Dr. Natalie Dupre is associate professor actually now. She's been promoted. She is a cancer researcher and environmental epidemiologist. Dr. Brian Gwynn, who leads our MPH program, is expert in lead, again, an environmental epidemiologist. And finally, Dr. Tashura Ali anchors infectious diseases in our department. She overlaps into the School of Medicine, Department of Division, rather, of infectious disease. Next slide. Just a rundown of ongoing research. We'll talk more in our breakout session about what our faculty are individually involved in. As I'd noted, Dr. Boone is involved in this new cohort study, Risk Underlying Rural Areas Longitudinal or Rural Cohort Study. It is a major multi-million-dollar new study being conducted, collaborating with epidemiologists across 4 states in the southern US. Dr. Natalie Dupre is conducting research on the environmental causes of colorectal cancer in Kentucky. Dr. Nick Piper has a variety of different things he's doing. Both he and Dr. Dupre have grant proposals to the National Institutes of Health that are under review presently. Dr. Gwynn, once again, is our lead expert. Dr. Zhang studies the way in which nanometal particles may induce lung injury. Next slide. So we have multiple collaborations and partnerships across the university as well as externally. We have intensive collaborations, first and foremost, with the Christina Lee Brown Environment Institute and the School of Medicine. Also, the Integrated Health Science Facility Core in the Environmental Health Sciences, the UofL Superfund Research Center. We've had students go through the NIEHST 32 Environmental Health Sciences Training Program. We have a long history of collaborations with the Brown Cancer Center, and the Kentucky Cancer Program, the Eating Anxiety Treatment Laboratory Clinic, which is rapidly growing. And we also have external collaborations with another large cohort study out of the University of Alabama, Birmingham, known as the Regard Study, Reasons for Ethnic and Geographic Differences in Stroke Risk. So you can see we have very broad collaborations internally and externally. Next slide. Oh, well, I'm just not going to go through this, but this is just a list of publications. Our faculty uh, are probably publishing an average of about 8, 9 papers per year. Uh, in red here, I just want to show the students that many of our students become authors or co-authors on publications that we produce. So you can see those in red are some past students. So we're very active in trying to promote our students' careers, and we placed many of our graduates in high-level places, both in public, private, and academic settings. Do we have any more slides? Next one, please. Okay, I'm done. Thank you very much. We'll talk to you more later in our breakout session.
Thank you, Dr. Baumgartner. Next, we have Dr. Lee Bewley, who will be representing Department of Health Management and System Sciences.
Thank you, ma'am. Good morning. This is Lee Bewley. I am the Director of Health Management Programs at the University of Louisville in our School of Public Health. For those folks that are online and have a little bit of audio visual, if you think that I'm late here at our house with Christmas decorations going down, I'll have you know that in addition to a substantial and hearty University of Louisville Cardinal spirit, we have a holiday spirit year-round. So what you're seeing is a Valentine's tree. And so we hope that spirit carries through. Look, let me tell you a bit about our department, and we look forward to any of you that join us in our breakout sessions to obtain a little bit more granularity and insight into our graduate programs. Our department, Health Management and System Sciences, is dedicated to the development of organizational leaders who are competent and can effectively and efficiently utilize resources to serve people, communities, populations, patients, their family members. And we also aim to inform those organizational leaders through policy in order to be able to have enhanced levels of population health. And so what programs do we offer in order to achieve those effects? We have a doctoral program, a track of our public health doctorate in health management and policy that is intended to dedicate individuals toward a path in research or some applied advanced research and practice in health administration and organizational leadership. Our program currently that has a great deal of subscription and a lot of building group of alumni is our Master of Science in Health Administration degree program. It is accredited by the Commission on Accreditation of Healthcare Management Education, nationally ranked, and we are transitioning to an online track and program exclusively beginning in fall of 2026 to offer the broadest possible participation to develop those leaders of healthcare organizations. And so we'll have a couple of opportunities for students to admit to program. For those students that are coming in with some organizational experience, perhaps mid-careerist, and they're looking to extend their career, or early careerists, we will have options. For students that do not have experience in healthcare, they can be admitted to our program and they would complete a integrative learning experience through a practicum. And for those students that come to our program with experience, perhaps currently working in a healthcare organization, no practicum is required. And so we can go into more detail in the breakout session. We have a Master of Science in Public Health with a focus in health policy. And again, those are practitioners that shape and manage knowledge development in order to inform the leaders of health organizations, as well as our public service leaders at the federal, national, and local level. We have a couple of ways that students can be in more than one program. The MPH Health Policy and MSHA program share credit hours. And so a student over a period of time, generally at least 3 years, may be able to earn 2 degrees. And similarly, the MBA program at the University of Louisville accepts 9 hours of our MSHA credits. And so over a period of time, a student could dually earn an MBA and an MSHA. And then our MPH program credits can contribute toward earning a doctorate. For those folks that have a bachelor's degree or perhaps a master's and they're looking for continuing extended education, we have 3 graduate certificate programs: healthcare financial management, healthcare quality and project management. These courses are components of our Master's in Science and Health Administration program, which provides a basis that if a student completes a certificate program within a period of 5 years and grades of A or B, they can transition those credits from a graduate certificate into the full MSHA if they choose. And then for those students that perhaps are finishing an undergraduate program at the University of Louisville, want to gateway into healthcare management, we offer a minor that includes 2 courses that contribute towards the MSHA after graduation from the undergrad UofL and then admission into the MSHA. Next slide, please. Look, we have great teammates, ranging anywhere from some relatively new members of our graduate faculty with the latest in doctoral education and beginning a really strong research paths to faculty that are some of the most accomplished and published researchers at the University of Louisville and in fact across the country. And we are complemented by a group of part-time lecturers and adjunct faculty that are healthcare executives in the local area with doctorates or an extensive record of teaching and service. We have a couple of great executive and residents that recently were chief medical officers and directors of population health in our local health systems. And these individuals are dedicated to the development of our students, to enhance the ability of individuals in organizations and in the practice of health management and health policy to be competent and to be able to serve to the greatest effect. Next slide. We have a number of opportunities in the area to draw upon the knowledge of our community. We think that the Louisville, Kentucky, and the metropolitan Louisville, Kentuckiana area is a rich learning environment, an opportunity to draw upon resources to serve our students, but also a great basis to have a career in our area serving the people of the Bluegrass State and the surrounding region. And so there's internship programs. We have one of our recent alums developed a relationship at Johns Hopkins for a student to complete an internship there in Baltimore. We have a number of our partners that provide the basis for some of our coursework, opportunities for students to have real world practice on current problems and opportunities. And we also have a case that we want to ensure that our curriculum is always a forward-looking, relevant curriculum that enables people to be able to go out and to not have great discovery on the wrong end of the case, but rather to work on problems while they're in graduate student status so that they're prepared for those roles after graduation. Next slide. Accomplishments and recognitions. This area is focused primarily on our students. We see that our students, and by extension our alumni, often serve as our program and our faculty and staff's greatest credentials. And so we have a number of our doctoral students that are out in the field, continuing to develop future leaders and researchers. These folks are on faculty at a number of our major research institutions. Our Master's in Science Health Administration program is currently, in addition to being CAMI accredited, is ranked number 46 of 158 accredited programs across the country. We're continuing to look to move up in the rankings. And so attracting new Cardinals that go out and do great things after graduation is one of the prime ways that we do it. In the past several years, each year, we've had a number of students that were competitively selected for postgraduate administrative fellowships. We had a student recently win the National American College of Healthcare Executives Stall Essay Contest. And each year we have extramural opportunities for our students to go out and represent the program, to compete in case study competitions, which also provides a basis to interact with colleagues from other programs, future employers, and to receive feedback on their performance and preparation for postgraduate work. And so these case study competitions, we've had finalists, semifinalists, and just last year, one of our students was noted as the best presenter. Recognition comes, we have a School of Public Health Alumni of the Year in 2023, and just 2024, one of our students was recognized as the commencement speaker to represent all students. Before I transition over, I want to make point that our program is continuing to working to collaborate with colleagues across the university and within our own school. In addition to the programs that we noted in our department, and if folks are interested in this program, we have a master's in science in artificial intelligence and medicine. There's a collaboration with the School of Medicine. There's 30 credit hours. 4 of those 10 courses are taught by faculty at the School of Public Health and in our department. And then looking to the future, we expect that there will be a doctoral program in artificial intelligence and medical services. So if you're interested in that program or any of ours, I hope that you join us in the breakout session. Without further ado, I will please proceed to the next slide. And I believe my colleague, Dr. Jelani Kerr, will cover opportunities within the department.
Thank you very much. Hi, everyone. My name is Jelani Kerr. I'm an associate professor in health promotion and behavioral sciences. I'm interim chair of this department. Very proud of the work that we're doing that the entire school is doing at the University of Louisville, but in particular, the work of this department. We we're what I call the problem-solving arm in public health. Not exclusively that we're the only department that solves problems, but that is the majority of our focus. So I'm excited to be here today to talk to you a little more about it. So we currently have 3 programs across undergrad, master's, and PhD offerings. Our undergraduate minor focuses on understanding what impacts people's health at an individual level and larger social levels, and the strategies that we can use to improve them. Our MPH concentration takes a deeper dive into the science and practice of developing, implementing, and evaluating interventions in these regards. And our PhD program helps develop expertise and understanding how to do research in a way that helps us understand public health problems and how to solve them. Next slide. So we have lots of accomplished faculty and lots of accomplished students in our program. And they come from different backgrounds and career stages. One thing I like about our faculty and students is that we have people with backgrounds within public health and outside of public health. And so this helps provide an array of perspectives that you otherwise wouldn't get. We're very committed to diversity and believe that our students grow when there are different perspectives in the rooms, and we embrace that. Our students also get opportunities to partner with faculty on research projects and do presentations and conferences and write papers. And this helps make our students more competitive for the job market and secure employment across academic, nonprofit, government, and private sector spaces. Next slide. So we have a wide array of faculty expertise with foci across different aspects of health, including mental and emotional health, youth development, wealth and health, HIV, cancer, LGBTQ health, plus health, and the health of racial and ethnic minorities. However, one thing that we all have in common is a focus on health equity. Next slide. Much of our research goes beyond measuring inequities to partnering with communities to address them. In this slide, you'll see just a small smattering of some of the projects we have done, especially in terms of our public-facing work in the media and in art spaces. This includes media campaigns to increase HIV testing, to address mental health, and reduce violence. That includes structural violence, which is violence that may be perpetuated by larger systems, and interpersonal violence, such as gun violence. Next slide. Okay, so I see we're running low on time, but here are some of our community partners. So I won't read them all, but this just But this highlights our commitment to a community engaged research and practice and how we value our partnerships and work with getting outside the school and going into the front lines to help address some of the challenges in public health. Next slide. I'll say this one last thing. We're very proud of the accomplishments of our students and faculty within our department. Some of the most important ones are helping to establish permanent affordable housing in Louisville, research that has helped lead local banks to eliminate overdraft fees, and our award-winning media campaigning around violence prevention, and the fact that a number of our students have been able to secure their own grant funding and support their research. So this speaks to our accomplishments of our work and the effectiveness of our training. It looks like we're about to go into our breakout sessions. So thank you for your time.
Thank you, Dr. Kerr. Okay, it's time for our breakout sessions now. So we still have 5 minutes before we open our breakout session. So this is time for our audience. If they have any follow-up questions for our chairs and our department representatives who just talked about their department. So if you have any question, you can either unmute yourself and ask your question directly, or you can put it in your chat box. So we will give this 5 minutes for Q&A. Anyone has any questions? Okay, let's check the chat room. Okay. Well, since no one has any question right away, we will open the breakout sessions. You have a couple more minutes, so we will take this time to go into the breakout rooms. So I will be opening up the rooms. You can see it on your screen. You can definitely jump in and out of any breakout room during your 45-minute session next. If you have any issues, you can come back to this main room where I will be there to help you navigate if you have any problems or issues getting into the breakout room. With that, let me quickly stop the recording and okay, welcome back everyone to the student panel discussion with our students at the School of Public Health. We will start with a brief introduction. So again, I'm Deepti Miller. I work at the School of Public Health for student recruitment. And with me, I have our amazing student panel here. We'll start with Samyukta because I can see her first in my screen, and then we can pass it on. Samyukta, you can pass it to the next person. And once we are done with the introduction, we will have a Q&A with our student panel. If of our prospective students have any question in mind, you can either write it in the chat box or you can even raise your hand and ask your question. So we will go ahead and start the panel. What's Samyukta?
Hi, my name is Samyukta Jaganathan. I'm a junior this year and I'm a public health major doing a bachelor's in science in it, and I'm on the pre-med track.
Hi, my name is Finley Whitaker, and I'm also a junior getting a BS in public health on the pre-dental track.
Hi, I'm Sydney. I'm currently a Master of Science in Healthcare Administration student, a second year, and I also got my Bachelor of Science in Public Health with a minor in Healthcare Management from UofL.
Hi, my name is Pavna Yadav. I'm part of the MPH program and my concentration is in epidemiology.
Good morning, everyone. My name is Michael Massey. I'm a second year Master's of Public Health student from Louisville, and I got my Bachelor's of Public Health here from UofL.
Brendan, I think you can go next.
I think you're muted, Brandon.
Brendan, you're still muted. Yeah.
Something's wrong with his microphone.
Okay. He is the last one to introduce. Okay.
I will
Yes.
tell you, Brandon Sullivan is a PhD in biostats. We
Yeah.
still can't hear you.
Yeah. I think his microphone is not working. Okay, we will wait for him. And so while we are waiting, please feel free to put in your questions in the chat box. And we also have prepared a list of questions for our panelist here. So while we are waiting on questions, we will go ahead and ask them. So feel free, our panelists, whoever wants to go first and answer those questions, we can do that. So the first question that we have, or discussion I would say have here is, could you please share your favorite sport on the campus or city for a quick escape or a moment of relaxation?
I can go first if that's okay.
Mm-hmm.
Since I've studied on both campuses, on Belknap, I really enjoy spending time in the commuter student lounge in the student activity sector on the second floor, just because it has a lot of really cool, like high-rise tables. I don't know if that's the specific word for it or specific name for it. And then on the HSE, I spend most of my time in the student lounge downstairs, just because that's the lounge that I'm used to in that building. Though I do want to start taking advantage of the new health promotion student lounge on the second floor, right next to Sam's office. So just really cool, relaxing places.
I personally like to go outside of campus, like within Louisville. And some of my favorite places kind of like get away is to go to like different coffee shops. I like to try a new coffee shop each week. So yesterday I went to this place called SPHIS, and it just has like really like cool seating, and it's always nice to try a fun new drink while I'm, trying to still study. So it feels like best of both worlds, kind of relaxing and still studying.
One of my favorite places to go on the Belknap campus is actually the front lawn of Ekstrom Library. When it starts to get warmer, you can see students bring like blankets and bring snacks, and they work on their tables with or on their blankets with their laptops or just hang out. And I've also seen people bring like volleyballs or soccer balls, and it's just really fun atmosphere, whether you're wanting to study or just kind of people watch.
I really enjoy going to the BAB, the Belknap Academic Building. I feel like on the second floor there, it's just a really good spot to have some quiet time. And the booths that they kind of have there that have the tables are really good to just sit in and focus up and really be able to study really well there.
For me, I was going to say the third floor of the library on the Belknap campus, just because there are tiny little nooks and they're sort of closed off, so it's really nice to decompress there.
Thank you all. Brendan, were you able to work on your mic? Is it working? No, it's still not working. Okay. Maybe, Brendan, you might want to log off and log back in, and that might help. Okay, so that was our first question, just to get our viewers or attendees, know about our campus and also know where our students usually go hide out when they're not having classes and want to spend their time on campus. So we have plenty of other questions, but I will pause here and ask if anyone from our audience have any questions for our panelist. Yes,
Hello.
Abdul Hamid.
All right. My question is to the MPH students. I'm an international student. So, what is that one thing that you wish you had known before program that would have helped you prepare better? And also, as an international student,
Any
thank
MPH or graduate student would like to answer that? Now, Michael, I think for the MPH, is there anything that can help Abdul Hamid prepare for the program or being an international student? Do you think there are any resources that might help him?
So before I go into my answer, I do want to clarify I'm a domestic student. So um, thinking back from my friends and my classmates that are international students, they wish that they had researched a little bit more about the Louisville area, like looking at maps, looking at different opportunities here in the city that would be easier to obtain or easier to engage in just because of their status as an international student. And so there are a lot of opportunities here. It's just knowing about them before getting here. I would say also reviewing things like your flight plan or like what any materials that you would need to look at for like admissions. We also have like really great resources here for international students, like the International Center. I think it's located on the Belknap campus. So those are great ways to get involved in the community. And most people here on campus are pretty cool. So like they would be more than willing to like help you settle down, settle in.
Yeah, I was gonna say about the same thing as Michael did, where using your resources, our international office is pretty open and available to helping international students accommodate to the university and making sure that they complete all the core requirements that would be needed to immigrate or to like study here. And then for classes, just making sure that you're taking a correct amount of in-person classes for your visa status. And then outside of that, international students also have a bunch of student-led organizations that you could also interact with, such as OASIS, Global Student Organization, IGSA. So a lot of the master's or PhD students also have specific clubs that you can join where you can find community in that as well.
Thank you, Bhavana. And I have shared the link for Oasis here in the chat box. It's a great resource, great community where international students can meet up or even, get familiar with Louisville and the neighborhood here, and also find host families sometimes who are willing to host them for a couple of days in the beginning when they are here, when international students are here, and trying to find accommodation. And Abdul Hamid, I will add on to that about other resources. As Michael mentioned, it is always important that you be prepared for your program as well. Know what courses you are getting into, get all the things that you would need to be, comfortable here in your program as well as in the city.
all right, thank you so much. Thank you
Mhm.
very much.
Of course.
I really appreciate.
Thank you. Any other question from our attendee?
Sorry, my second part of the question,
Mhm.
I don't know if it's formal to say it here about all that is happening with eyes and the safety issue. I don't know how to put that in the question. Like the current administration, what is happening, what we see on the television. And
We would prefer not to comment on that, Abdul Hamid, because this is all what's happening. There are several things happening regarding student coming here to United States to study, international students, but our advice would be to follow all policies, rules, and regulations, and also keep a close eye on the visa process and be safe and try to do everything as per required for the student visa to come here. And the
All
most
right.
important part, apply on time because it's a time consuming process right now.
Already applied. Hopefully waiting.
Okay, fingers crossed. Thank you.
Yeah. Yeah. Thank you.
Okay, anyone else? Any other question? Well, we have another question for our panelists. Let's see if we can find a fun one. Were you involved in any extracurricular activities or student organizations within the School of Public Health or at UofL that helped you, in your overall educational experience?
I think I'll answer this one because one thing I think feel like UofL has really given me is like a community, whether it's like directly impacting my education or just like kind of forming a community. But one thing I really like about public health, our specific department, is like they're always sending you like a bunch of resources for you to get involved on campus, whether that's like general organization. So I joined this organization called Conversations to Remember, or if it's like other like resources to get like internships like within public health. And I felt like throughout my process as like an undergrad, like I've done a lot to like be a part of the community. So in terms of like getting like educational support, like UofL for undergrads like offers different like free tutoring sessions, which I've like taken a part of, and I've like tutored other students. And then within that, like UofL in general has many registered student organizations that I'm a part of. And I feel like the School of Public Health like really encourages getting involved, whether it's like on campus or like within public health. I know like we have like a few different public health clubs that like students are a part of, and it really does form like a sense of community because at least within the undergrad program, like we are smaller. And so like by the time you finish like your whole undergrad program, you end up knowing like a lot of the students within your classes. It's kind of like the same students, and you really do form like friendship and community. And that's been something that I've really enjoyed throughout my undergrad year at UofL.
Anyone else?
I would say like the faculty and the advising support within the School of Public Health has been very, very valuable. Everyone's always really accessible and wants to just see all their students succeed and have all the opportunities that they can. So I've really appreciated that.
Okay. Brandon, is your mic working? Would you like to go ahead and do your
Um,
introduction?
is
Yes, awesome.
okay, cool. Yeah, I just joined from my phone. Um, okay, so as far as like extracurricular activities, I I will say that like as like a grad student, there's not it's not necessarily quite the same as extracurricular activities that other panelists may have experienced through kind of going through U of L proper, so to speak. So, doing an undergraduate graduate program at U of L. However, you know, I do know that there are a number of U of L resources that have been very sort of helpful for me through my time here so far. So even just having like access to the exercise facility on the main campus and also on the health science campus, you know, that's a very helpful thing. And they have a lot of cool things you can do at those places. Like, you can check out badminton equipment, or they have like golf simulators too if you're into that sort of stuff. So I know that's kind of not totally what the question was asking, but just kind of in terms of like my experience at U of L, um, you kind of figure out like, okay, what are things that sort of make me happy, and whether or not that's part of like a proper extracurricular, club or something like that, or if it's just something where you say, I like doing this, or let, I'll go with a friend and we'll go do something fun at one of those places. The exercise facilities are just sort of what come to mind, but like you could, if you're into checking out a sports game, U of L has a lot of, even they're most famous, of course, for football and basketball, I guess, but you can go watch a field hockey game. That's, you could do something like that. That's I think free for students. And so, yeah, again, I know I'm kind of going off script here on the question, but I saw a comment come through, but since I'm on my phone, I can't see what it said. So I'll stop talking. Hold on. Oh, someone was just reiterating the question. I don't know. Okay. Okay.
Yeah, thank you for sharing that, Brendan. We have a question in the chat box. We'll take that. I'll answer the first part and then I'll open it up to our MPH students and also graduate students who would like to share their experience if they have any graduate assistantship currently with the school or with UofL. So the first part is if someone is now about to apply for MPH research, is the person required to get an advisor before? So the answer to that is no. If you're applying for our new MPH research concentration, you don't have to get an advisor. You can directly apply and we can go through your application. If you want, we can definitely get you connected to our faculty and director of the program. So that is definitely doable. Now, for the second part of the question, there are research assistantship or graduate assistantship positions that what we call here at the university available both for domestic and international students. But how they get it or what is the process, I would like our students to talk their experience if they have one.
I'm currently a communications and marketing graduate assistant in the Office of Philanthropy and Alumni Engagement. And it's really allowed me to gain a lot of transferable skills, like even though it's not necessarily in public health and healthcare administration, which is my career trajectories, it's really helped me to have some of that financial burden taken off and then also just network with people, connect with people, really get involved in the campus and just really gain those transferable skills. And for that, I was looking around a lot. I saw that the Employee Center and like the Office of Philanthropy and Alumni Engagement, they often have a lot of graduate assistantships available for people, whether that's in annual giving, engagement, or communications.
Sydney, could you please add to that how you came across this opportunity and what was the process of getting into a GA? Thank you.
Yeah, so I found the job posting on Cardinal Careers. I just was browsing it every day because I really wanted to find a graduate assistantship, and that one popped up. So I quickly applied, and I also applied to a couple others that presented themselves. And through that, I just sort of talked to the supervisors there, had a couple of different rounds of interviews, submitted my resume and a little bit of a portfolio of past work experience that was necessary and like aligned with the job opportunities and job responsibilities. And through that, I was able to gain the position.
Thank you. Anyone else?
Yeah, I also hold a GA position. I work at the graduate school office directly. For the most part, with grad assistantships, it's divided into three specific roles. You have the administration aspect, which I'm working in, and then you have the GTAs, which are graduate teaching assistants, which is more tied to your program and if they have undergrad classes that they want graduate students helping to teach. And then you have like the GRAs, which are the graduate research assistants. So there's three main types, and usually they're on the graduate website whenever they open up as well. That's how I found about my role. But you can look on there, and the process is pretty similar to an interview process where you just submit your resume, and then afterwards you'll hear back if they want to do an interview or not, and then maybe you'll have an extra round according to the position. But yeah.
Any other panelists like to share their job or any extra curricular they are doing at campus?
I can share just briefly. So in the biostatistics department, typically speaking, people either will be graders for classes or work on research projects that might be kind of funded through, a variety of different sources, but usually it's through either the Kentucky state government, from what I've seen, or through the Louisville Metro Public Health Department. That's what I'm currently on. Um, I also last year was funded to work with a psychology lab on the main campus. Um, so sort of the way that those sorts of projects can work. I mentioned sort of these different sources just because it's maybe a feature of the biostatistics department that you get a lot of exposure to different departments and different types of work. And it's sort of an interesting thing where you get to see, okay, there's sort of a number of ways in which the skills that I'm learning can be used. So it's one of those things where you kind of never quite know you know uh what the job might look like, but there's definitely plenty of opportunities in a variety of areas.
Thank you, Brandon. Any other questions from our attendees? Okay, I'll move on to our next question. Meanwhile, again, if you have any questions, feel free to put it in the chat box, or you can unmute yourself and ask it directly as well. So the next question is again on the opportunities the school provides. So what opportunities do you think the School of Public Health provided or have provides to students to engage with public health professionals and experts?
I can go first, if that's okay. Thinking back on my time here, since I've been here for 4 years, it really starts in the classroom. I've had multiple professors bring in active public health professionals into class to give either guest lectures, to actually do a Q&A. So for example, I'm thinking of Dr. Robin Weiss's public health practice class, which literally revolves around understanding the public health career field. And so she brought in a range of alumni and people, professionals that she knew, to give us a range of perspectives. It wasn't just people who are epidemiologists or people who are in maternal and child health, which is what she tends to focus on the latter. And so that was a great way for me to understand what is available within the field. I know other people who teach classes. So I know Jenna's on the call. She actually is wanting students in her PHPH 200, I think it's the sophomore experience class, to engage with alumni later in the semester. So just opportunities like that are always present. And on the graduate level, I know instructors like Dr. Gwynn do something very similar. Well, he'll bring in, Bravna, you were in this class. It was the U.S. Public Health Service and people from Kentucky Emergency Preparedness to come in and give us some lectures about their experiences as well. And there are also just other ways, more, I guess, formal or bigger experiences that the school provides as well. I know in previous years, I think it's happening again this year, Deal Day, which was an experience for students to meet local, like Kentucky based entities in public health. So in the past, when I was participating, it was like emergency preparedness again, harm reduction specialists. I think we also had some people from the U.S. Public Health Service as well. And then we also have like the annual Woodson lecture. which is an annual seminar where the School of Public Health will invite an active, like prominent public health professional to come in and give some insight into a really important public health topic. So this previous semester, since they usually happen in the fall, so fall of 2025, we had Dr. Megan Rainey from the Yale School of Public Health give a lecture. It was awesome to attend.
I can add something. So Michael covered a large scale of that, but also I'm not sure who all is an undergraduate student and looking at that, but the School of Public Health does have opportunities through structured internships and capstone the senior year, their last year that they are with the program. And also, I just want to add that like the faculty within the School of Public Health is very nice and they have such a large network, whether that's working with people or knowing people from Louisville Metro, local health departments, or just local nonprofits throughout Louisville. They're very connected, and a lot of them are very willing to help you find someone within your field of interest and help you get a contact and get more involved and interested in whatever you're leaning towards.
Anyone else?
I guess I'll kind of add to what Finley and Michael have kind of said, but like a lot of our classes, like at least in undergrad, like when you like reach that upper level, it's more geared towards like internship, like getting you connected, kind of really like bridging the gap from like education to like real world like career. And so I'm currently in a class called PHPH 303, which is just geared towards like getting you ready to like apply for like internships. I think Finley's also in that class with me. And so like we kind of prepare our LinkedIn. We're like one of our assignments is to go to like a public health event and kind of meet people. So there's a lot of ways that like the public health like department and our advisors ensure that like we aren't just like learning, but we're also like able to like apply what we've learned into the real world. And like as everyone say, like our advisors do a great job. I think Tammy's on this call, but like she like probably every other day sends like a bunch of internships that are available to undergrad and grad students. And if there's any opportunity available, like they'll help you find it or they'll, give you a contact to for someone else to like help you find their opportunity. So I feel like if there's like a will, there's a way. And that's definitely how like our program's set up, I would say.
I'm going to piggyback off of that because that was I agree 100%. And also it made me think of the Career Center and student success coordinators that Louisville has. Um, the Career Center is a great place where they can look over your resume. They can help you prepare for interviews. They have interview preps. I know my freshman year of so my first year of undergrad, I wasn't really sure what I wanted to do, and so I had an hour-long sit down with an a career coach advising, and that really helped me kind of figure out what I want to do, and she helped me align my interests and put everything together and help start connecting me to different faculty members. I will say everyone at U of L is very nice and welcoming, and they want to see you succeed, and they know people that can help you, and they want to help you see or help you climb that ladder and get to where you want to be.
Yeah, I would definitely say that my professors have as well have definitely like honed in on the importance of really diving into that alumni network at U of L. I know through that I was able to obtain a summer internship up in Baltimore, Maryland at Johns Hopkins just because my professor knew a past U of L grad from our program that had a position there and wanted to reach out and sort of get a student there for an internship. So I just think it's really great how much they're able to just make those connections. They'll say, like, scroll through my LinkedIn connections. If you see someone you're interested in talking to, like, let me know. I'll handle that introduction and really just get the ball rolling. So I think all that is just really great opportunities to engage with different people.
Thank you all for sharing that. On that note, since we are talking about internships and capstone experience at the school with your classroom learning, could you share a memorable experience or lesson that you learned during your internship or field work that significantly impacted your perspective on public health?
I feel like during my summer internship, I was really able to just gain more of an understanding of the significance of the size of like hospitals you're working at and how what they're doing at the larger hospitals can still be implemented at some of the smaller organizations and smaller communities. So over the summer, I was able to complete a healthcare administrative internship at Johns Hopkins, and it was just such a surreal experience. I never thought that that would be an opportunity that I would even be able to have. And just being there and just seeing everything they were working on and all of the just community aspects that they had, and just trying to find ways where, okay, how could this be applied to somewhere like in Louisville, like a lot smaller setting? So it's really just put into perspective just a lot of different things that one can accomplish as long as you go for it.
Anyone else?
For me, I have not currently completed an internship. However, I joined a student organization called RAM chapter, so Remote Area Medical. And basically, this is a national nonprofit where volunteers across America, whether that's student volunteers like me, or health professional volunteers, or just anyone in the community, come together and they're able to offer a free clinic for dental, vision, and medical. So it's all volunteer based. And through the UofL chapter, I paid my dues to be a part of the organization, and then I was selected to go on a trip over the weekend, and I got to see how many parts there are to this organization. It is amazing. If you haven't heard of it before, it's RAM, Remote Area Medical, and you should look into it. There's so many different pieces that come together, whether that's organizing all of the health professionals to come to one place and be able to provide free service for anyone they don't need health insurance or identification. It's just all volunteer based, and it was an amazing experience. And I was able to see many different perspectives, not just the patient provider interactions, but on a larger scale of how this impacts communities that are medically underserved and really need care.
I never heard of that, Finley. Thank you for sharing that. I'll definitely keep that for my note to share with other prospective students. Okay. So we have one question here in the chat box. It's regarding funding, so we will quickly address that. How can I fund my MPH graduation or education? So for MPH or any other graduate education, I have shared the link where we have various funding opportunities available at the university website. It's listed there. So you can, go through that link and figure out what suits best. Also, the follow-up question is what moment should I apply for that? So I would say this is a general suggestion. If you are really looking into funding, the first step is to get into UofL. That means to get your acceptance. So apply as soon as possible whenever you're ready to apply for your program, get all your documents submitted, and then once you hear back, once you have your acceptance letter from UofL, then your door opens. Then technically you can, talk to various departments, see if they have any assistantship positions or any other fundings, or also get in touch with faculties and other organizations within the university, or even organizations which are partnered to the university, to see if they have any funding available to help you finish your degree. So the key to that is be on time, submit your application on time, and make sure that you meet all the deadlines for application as well as for funding. Okay. Any other question? Well, we'll take one more question here. We have one more question for our students here, and then we will call it a day. It's a Saturday. I understand everyone is taking out time on a weekend. So the next question we have is about resources and support services. I know we talked a lot about how helpful our faculties are and how helpful the organizations are, but if you would like to highlight or spotlight any one resource or support on campus that you have found the most helpful during your student journey here.
I'll shout out the Writing Center. Oh, sorry, Samyukta, if it's okay for me to go first.
Oh,
So the
of
Writing
course,
Center
yeah.
is a it's a free resource for any student, undergraduate, graduate students. If you have any written assignment, you can ask for help at any step of the process. They do expect you to do the work. I should emphasize that now. A few students have asked me that before. But for example, anything from brainstorming to one final look over just to check grammar and spelling. It's great to make sure that you have a second pair of eyes that isn't your professor, like a disinterested third party, well, interested third party, who is just able to help you. So I would really recommend it. They have a Belknap campus location, an HSC location, and you can also do remote asynchronous submissions if you would like.
To kind of go back on that, there's like a few different resources also available. So more catered towards like undergrad and grad. There's also like the Digital Resource Center in the Belknap campus, where like if you're making any type of like video portfolio or anything of that sort, they're willing to like lend you their equipment. If you have to like record like a video, need like good like microphones, they have all that for free during their hours. And there's like people who can like help you with that if you like don't know how to do that. Also, for undergrad students, there's Reach. Reach is a free tutoring session where it's for any course essentially, where students tutor other students in that course. I've done that for 3 semesters, and I've also gone as like a tutee. It's a great way to like learn and kind of continue learning and to have that knowledge fresh in your mind. And then there's also PAL, which is peer assisted learning, which is usually like a student who like goes to the class and then they have like two 75-minute review sessions each week. And it's a great way if you're like struggling in class just a bit, or just to get some like extra review with like a peer setting, so it's not as overwhelming to study. So I think there's definitely great support systems to make sure that you're not falling behind in your classes, but also professors are really great. If you let them know that you're struggling, you're a bit confused, I always say like, they're not scary. They're just like us, but maybe a bit older, and they're always willing to help us in anything that we need.
I'll go really quickly. I think a very good resource, it's just maybe not always thought of as a resource, is the U of L library system. Um, so just for example, I've been able to check out a number of textbooks that I've needed just through the library, which is kind of an underutilized trick. And hopefully you guys don't use it too much so that way my books go missing. But no, I'm kidding. But that's a very helpful thing. You know, and I would also say that yeah, can you hear me?
Oh, good.
Oh, cool. Okay. Yeah, and then also,
Yeah.
U of L does have a high performance computing cluster. Um, and so that's, kind of a very helpful resource also. Um, and I mentioned that because I actually I don't totally, well, I might need it in a little bit, but I kind of got the ball rolling on getting an account with those people, but I know I need to do it again. So they're kind of on the top of my mind. But anyway, that's a very useful thing for, being a student and, having to complete certain projects and things like that. I know that's not like the sort of maybe resource that we're talking about in general here, but I just thought I'd give my 2 cents for a moment. So, yeah.
Any other resource, anything you all would like to highlight?
I know that the graduate office also offers specific like 1 hour workshops for different types of professional like areas. For example, like resume, LinkedIn, connecting with your mentors, writing grants, and stuff like that. So that's more on the graduate level, but they are a really good resource for figuring out how to navigate grad school in general.
Awesome. Thank you all. There's one more question, so we'll take that question in the chat box. We have, I think we are over time, 2 minutes, but the last question we'll take it up and we'll call it a day. So, do MPH students realistically have time to stay involved in campus football leagues during the semester, or does the workload make that difficult? So, quickly, our MPH students, could you share your experience on the workload and how do you manage your day or other activities?
Since our
So I'm,
classes,
oh,
oh,
Bhavna, do you want to go?
oh, okay, I'll go first. Since our classes start from 4, usually it's as long as the activity is prior to that, like from 4 to 7 is usually our class time, as long as it doesn't uh like the event doesn't happen during that time and it doesn't coincide, usually there's not too much of an issue. We also have like a bunch of our classes online too, so the academic workload is not too bad for the MPH students. But you would definitely have to be a bit more proactive with your time management. I feel like in comparison to undergrad, though, I feel like my workload is a bit more lax.
Thank you.
I was just going to say the same thing as Bhavna. Since our classes are from 4 to 7, it is a little difficult if any activities are scheduled at that time. So I'll expand on that and just say that if you reach out to the activities, to like any coordinators or points of contact, and just say, hey, I'd like to participate, but I can't do it at that time. Depending on what the activity is, since I don't do intramural sports on campus, most groups are willing to accommodate in some way, shape, or form, even if it's just having you on like a contact list so that when your schedule does free up, maybe in like a future semester, or if you have days off, just like classes are canceled or there's like a scheduled class off, you can always just like pop in and just meet everyone. And so
Thank you. Well, with that, we would like to end this session. This has been great. Let's give a round of applause to our amazing student panel here and thank them for taking time out on a weekend. It's really helpful for our respective students and also us to understand directly from our students what they're liking and what they want to share with prospective students coming in. So thank you again. We love it. And if you have any questions, anything, feel free to reach out to me or any of our student services staff member. You all have our contact details. Also, we will be posting this on our social media. So if you liked it, you can go back and watch it again or share it with your friends and family. Thank you. You all have a great weekend. Students, panelists, you all can log off, and student services team, we will stay online for another 10 minutes just to take up any last minute questions or anything that you would like to share or discuss. Thank you.
Thanks.
Bye. Thank you all.
Bye.
Thank you.